Hi, my name is Francisco Murillo. I'm going to talk about Byron, the science for dietary supplementation to prevent cancer and heart disease. Introduction. The use of dietary supplement products is common in the United States. The National Health and Nutrition Examination surveyed the country from 1989 through 2012, the showing that more than half the adults in the United States they consume dietary supplements.
A dietary supplement is a manufactured product intended to supplement the diet when taken by mouth as a pill, capsule, tablet, or liquid. A supplement can provide nutrients either extracted from food sources or synthetic, individually or in combination, in order to increase the quantity of their consumption. The class of nutrient compounds includes vitamins, minerals, fiber, fatty acids, and amino acids. Dietary supplements can also contain substances that have not been confirmed as being essential to life, but are marketed as having a beneficial biological effect, such as plant pigments or polyphenols. Animals can also be a source of supplement ingredients, as for example collagen from chickens or fish. These are also sold individually and in combination, and may be combined with nutrient ingredients. In the United States and Canada, dietary supplements are considered a subset of foods, and are regulated accordingly. The European Commission has also established harmonized rules to help ensure that food supplements are safe and properly labeled. Among other countries, the definition of dietary supplements may vary as drugs or other classes of ingredients used in supplement products. Creating an industry estimated to have a 2015 value of $37 billion, there are more than 50,000 dietary supplement products marketed just in the United States, where about 50% of the American adult population consumes dietary supplements. Multivitamins are the most commonly used product. For those who fail to consume a balanced diet, the United States National Institutes of Health states that certain supplements may have value. In the United States, it is against federal regulations for supplement manufacturers to claim that these products prevent or treat any disease. Companies are allowed to use what is referred to as structure-function wording if there is substantiation of scientific evidence for a supplement providing a potential health effect. An example would be blank helps maintain healthy joints, but the label must bear a disclaimer that the Food and Drug Administration has not evaluated the claim and that the dietary supplement product is not intended to diagnose, treat, cure, or prevent any disease, because only a drug can legally make such a claim. The FDA enforces these regulations, and also prohibits the sale of supplements and supplement ingredients that are dangerous, or supplements not made according to standardized good manufacturing.
Application in medicine. The consumption for appetizers with a high content of fat and salt, or the intake of fast food with a rich composition of dietary fat and salt with negatively associated with a higher the prevalence of heart disease, principally in the most dis disadvantaged social economic disadvantaged group that generally consumes this type of
One of
food.
the most common questions I get from patients are, what are some supplements I can take for cardiac protection? Now, vitamins are extremely common. Most people take vitamins, but really the data for vitamins is extremely poor, especially for cardiac health. So there's been studies looking at vitamin C and vitamin E, and they're actually not beneficial at all. In fact, there's been a study looking at vitamin E supplementation, and it actually may lead to more heart failure and stroke. So we actually actively discourage our cardiac patients from taking vitamin E. Now, vitamin C probably doesn't do anything for the heart. So we tell them, if you want to take it for common cold, you can, but for heart protection, really there is no benefit. And most people think that maybe multivitamins helpful. Actually, it's actually no benefit for cardiac protection. There has never been a vitamin that actually helps protect the heart. Now, some people say, what about vitamin D? The data on vitamin D is extremely sketchy. Now, if your vitamin D level's very, very low, there might be benefit to supplementing vitamin D. But for the rest of us, the data is not very good. So for right now, we're going to wait for the trials for vitamin D, but really there's no data to support routine use of any of these vitamins for cardiac protection. Now, there are some over-the-counter vitamins that can definitely be harmful. And we really want you to talk to your doctor before you take any supplemental vitamins. There's been some vitamins that increase heart rates because they're made out of animal thyroid. Some of them actually increase heart rate and blood pressure. So we're very careful to tell our patients, especially our heart disease patients who are on antihypertensive medicine, to please speak to us before they take anything. There's also over-the-counter cholesterol-lowering medicine. Some of them actually have had multiple FDA warning letters about causing liver damage. There are vitamins that can definitely interfere with your cardiac medicine. So there are vitamins that can increase your bleeding time, for example, cause increase in your heart rate and in your blood pressure. And that can actually lower the efficacy of some of the medicines you're taking. So it's really important to talk to your doctor about the vitamins because some of them can definitely interact with your cardiac medications, making them less beneficial or maybe increasing or potentiating the effect. We worry most about bleeding complications. So there are patients with AFib who are on Coumadin or on newer anticoagulant agent, and then they get started on a supplement, and their bleeding time greatly increases, and they come in with profound bleeding events. So before you start any supplements, good idea to talk to your doctor about whether these supplements can harm or benefit you.
Pros and cons. Pros. Dietary guidelines continue to recommend restricting the intake of saturated fats. These recommendations follow largely from the observation that saturated fats can raise serum levels of total cholesterol. Cons. Supplementation with vitamin D3 has no effect in case of the invasive cancer on a relationship with serum vitamin D levels. Uses applying in Ecuador. In Ecuador, there are no studies of the supplement Dietary for the prevention of heart disease and cancer. In the Constitution, the article talk about the duty of good nutrition and the right to health, but it does not guarantee a diet with supplement for the catastrophic disease. Conclusion: Byron has no feeling these knowledge gap and completely show that the use of N3 fatty acids is not effective in preventing the combined endpoint on myocardial infarction, stroke, or death from the cardiovascular cause in usually the patients.
Ingrid Fauché Murphy tries to stay as fit as possible. She was diagnosed with breast cancer 7 years ago. As she waited for treatment, Murphy wanted to increase her odds. So she also went to a naturopathic doctor.
And he prescribed various multitude of vitamins, which included A, B, C, D, melatonin, 20 milligrams of melatonin, which is fairly high, and some other supplements like turmeric, which is antioxidant.
It was not a prescription her oncologist approved of. He worried popping vitamins would interfere with chemotherapy, a critical part of cancer treatment.
I thought I was pretty proud of myself that I was being very proactive in all of these vitamins. And he said immediately that I had to stop taking all of them.
This new study supports that advice. It followed 1,100 breast cancer patients in Canada and the US through treatment. 18% took vitamins like A, C, or E. Their risk of the cancer returning was 40% higher.